Let me introduce myself. I'm Dr. Himmath, consultant physician working at Taluk Headquarters Hospital, Kudumalur. I'm going to give you the topic is health diet for healthy heart. In today's session, we will discuss about the role of healthy diet for keeping our heart healthy. So, normally in a healthy person, blood pressure rises and falls throughout the day. But pressure higher than the normal for a longer period will damage the vital organs like heart, kidneys, then persistent increase in blood pressure higher than normal blood pressure is known as hypertension. Hypertension is a silent killer. It's only a warning sign. Usually, most of the people won't be knowing the symptoms of hypertension. Only after a long period, the person will realize he is having high hypertension. By the time the target organ damage might have been occurred. So it is a silent killer. Major cause for the raised blood pressure is the sedentary lifestyle and diet habits. So the diet is very important in the case of control of hypertension. Apart from that, stress, excessive salt intake, junk foods, and excessive intake of carbs. These are all major culprits of the so many effective medicines. But let me tell you, all that lifestyle modification like exercise and dietary changes are effective as medicine and can also help to prevent high blood pressure. So certain dietary approaches like DASH and Mediterranean diet have been engineered to reduce the high blood pressure in addition to specific dietary changes, and also need to manage for hypertension, uncontrolled hypertension. We will discuss these one by one. First thing, reduce salt intake. So whether you reduce the salt to 1500 milligram per day, maximum you can take it to 2000 milligram. 2000 milligrams comes around 1 teaspoon. So better reduce the amount of salt in diet. And coffee and tea, excessive intake of coffee and tea is also a major cause for raised blood pressure. So as far as possible, avoid excessive intake of coffee. Eating more fibers, fruits and vegetables will reduce the development of blood pressure. So it must be a practice to add vegetables, fruits and fiber containing diet in our regular food habits. Then let me say a few words about DASH. What is DASH? Dietary approach to stop hypertension. What I have said before, these are all methods to prevent the development of hypertension. The diet designed to control blood pressure and heart disease. There are variety of food stuffs which can do it. That is fruits, vegetable, whole grains, fish, poultry, nuts, and legumes, and low fat diet. All things are that is the dash. Then similar way there is another Mediterranean diet. That is it has many similarities with dash. That it includes generally dietary pattern higher in fat, primarily mono unsaturated fat from olive oil, nuts, seeds that gives commonly 40% of energy. The exercise pattern, brisk walking, at least a person has to take 150 minutes of regular exercise in a week. That comes around 2 hours to 30 minutes. Lastly, the bottom line is diet plays crucial role not only to developing but also to controlling the progression of heart disease. I advise to all patients to adopt a healthy lifestyle which plays an important role in not only treating heart complications but also in preventing it. Okay, let me conclude. Thank you.